Good afternoon. Good to have you in today's session. So today we'll be talking about the important MCQs related to the surgical infections. Okay. So let me just check whether the streaming is proper. Can you hear it from you? Can I hear it from you? Can you see me and listen to me properly? So, right? Can you hear me and listen to me properly? Can you just give me a thumbs up? Right. So in this session, we are going to talk about the important MCQs related to the surgical infections. I'll just checking it whether the streaming is going proper. Just give me a couple of seconds. Right. Okay. So I'm live now, and let us just discuss about this. Okay. So right. So what I've done is I've made like 10 MCQs related to the infections in general surgery, and I want you to participate in this. Okay. So this is a topic which usually is not covered in like when you read the general surgery proper. It is like in bits and parts. It is covered in microbiology and in other places. But what I decided is because a couple of MCQs are asked on this, so I just thought of covering 10 important MCQs related to the surgical infections. Okay, so let us begin and talk about this. Now this is a very simple diagnosis. Can you tell me what is the diagnosis of this particular patient? So I assume, like, I can see that 6 of you are watching me at this moment. So can you please tell me what is the spot diagnosis of this particular patient? Now just attempt whatever comes to your mind, guys. Okay, so please do tell me. I'll wait for a couple of seconds to hear back from you guys. Okay, so can you tell me what is the diagnosis? Yeah, what is the diagnosis, guys? Erysipelas. Very good. Nabruin, good, very good. So diagnosis is in fact erysipelas. So what is erysipelas? So please remember, because it is NEET, they can definitely ask you the other name of erysipelas also. So what is the other name of erysipelas? Erysipelas is also referred to as Saint Anthony's fever. Okay, so why is it referred to as a Saint Anthony's fever? It is referred to as a Saint Anthony's fever because it spreads very rapidly. Okay, so it is also referred to as a Saint Anthony's fever. And what exactly is erysipelas? It is basically a form, it is a superficial form of a cellulitis. Okay, so erysipelas is nothing else, it is just a superficial form of cellulitis, and it is also referred to as a Saint Anthony's fever. Very good, guys. So yes, in fact it is erysipelas. Okay, now another important MCQ is, which is the most common organism responsible for erysipelas? Is it staphylococcus, it is streptococcus, E. coli, or pseudomonas? Can you tell me, guys, what is the answer? So is it A, B, C, or D? What is the most common organism responsible for the erysipelas? The diagnosis which we just made. Can you tell me, guys? So Nabrun, what is the diagnosis? Like, which is the most common organism? Now this is again a very kind of important MCQ and very commonly asked MCQ. Can you just tell me whether it is A, B, C, or D? So Madhu is saying B, Nubrin is also saying B. Well, yes, guys. Good, very good. So it is basically a streptococcal in origin. So see what happens. They say that it is polymicrobial, but if they ask you one, then you all have to go for a streptococcus. So please understand, erysipelas, the most common organism responsible is in fact streptococcus. Good, very good, guys. Now, Sifmita, no, it is not staph. Laya, please understand, it is not staphylococcus, it is streptococcus. Okay, so this is a kind of a mistake which people do. It is a very simple question, it has been repeated a couple of times, but the diagnosis or what is the answer to this particular question is in fact streptococcus. Please understand this. Okay, now what about this? Can you tell me what is the spot diagnosis of this particular patient? So this is basically the infection which is occurring in one particular point. So very simple, nothing great about it. I'll just tell you what it is. What is it? It is basically a folliculitis. Okay, so what do you understand by the folliculitis? We have the hair follicle, and if at all that hair follicle gets infected, the infection can go to the root of the hair follicle, and that is what you call it as a folliculitis. Okay, some people like to call it as a furunculosis. So furunculosis, folliculitis. Okay, so one particular hair follicle or whatever the gland is getting infected. But if I show you the image like this, now this is important. Can you tell me what is kind of a diagnosis of this particular patient? Can anybody tell me, guys? So Nabrun, what is the diagnosis of this particular patient? Can you tell me, Nabrun? So Nabrun, very good. You inserted that. That was the folliculitis. Now Sindhuja, is it still a folliculitis? Can you tell me guys, what's the diagnosis? So Sushmita, Laya, Aya, Ajay, please tell me guys. So Nabrun is saying it's a carbuncle. So Madhu is also saying it is a carbuncle. Well, yes guys, good. It is in fact a carbuncle. So what is a carbuncle? So if at all many folliculitis come and join with each other, they lead to the formation of a carbuncle. Okay, so very good guys. So what is this? This is basically a carbuncle. Now let us talk a bit about carbuncle. So what is the predisposing factor for the formation of carbuncle? So patients who are immunocompromised, okay? So immunocompromised state, diabetes mellitus, all these are the predisposing factors for the formation of carbuncle. What exactly is a carbuncle? If a lot of folliculitis come together and coalesce with each other and lead to the formation of this kind of an image, this is basically a carbuncle. So if you see, there are multiple folliculitis or the multiple follicles which are getting infected in this, okay? So good, this is a carbuncle. Now if I ask you what is the treatment of this, so please understand the treatment of carbuncle is nothing else but a debridement, okay? So we'll have to go for a debridement of this. So you have to go for an extensive debridement, and then you will have to go for kind of a dressing, and when the granulation tissue occurs, you will have to go for a skin grafting or something like that, okay? So please understand this is a carbuncle and the treatment is debridement. Obviously you will have to start the patient on antibiotics and all those things, but the key treatment is debridement. Please understand this, okay? Right, now let us talk about the next MCQ. Let us move on and let us, okay, again the problem started. I'm really not able to figure out why this happens in every session. Just a minute guys, just give me a couple of minutes. Just give me a couple of seconds guys. Okay, right, now moving on to the next particular question. Now in this particular question, so I welcome all of you guys. Now I can see around 15 of you are here. We have already discussed a couple of MCQs, but you can join us from now, and now we'll be discussing at least 6 to 7 more MCQs in, let's say, 15 to 20 minutes. So it's just a short break for you. Let's move on. Okay, right. So if I ask you, in order to prevent a surgical site infection, now this is a very common question. I am sure you all must be knowing this. So let's give me the answer. In order to prevent the surgical site infection, we have to give a prophylactic antibiotics. Okay. So when do you give this prophylactic antibiotic? Okay. So is it 1 hour before the surgery? Is this 1 day before the surgery? Is it at the time of the incision or at the start of start it from 1 week before the surgery? So guys, can you give me? So Adi is saying it is 1 hour before the surgery. Okay. Is it true? Is it 1 hour before the surgery, guys? Or is it at the time of incision? Nobody for at the time of incision? Okay, well, good. So Naya, Kevin, Madhu, all of you are answering A, and you're absolutely correct. You guys are right. The answer to this particular question is in fact 1 hour before the surgery. So please understand, different sources give different time duration, but it is usually started 1 hour to 30 minutes before the surgery. So whatever is given in your option, you can choose that. So 1 hour before the surgery to 30 minutes before the surgery, whatever is given in the option, you can choose that. Now Sindhu Jam, no, it is not B. It is not 1 day before the surgery. You don't start it 1 day before the surgery. You started 1 hour to 30 minutes before the surgery. What is the rationale for starting it 1 hour before the surgery? So the rationale is, when you give the incision, the concentration of antibiotic should be maximum in the circulation, and that is why you have to start it 1 hour 30 minutes before the surgery. If at all 1 hour or 30 minutes is not given in the option, then the next best answer is at the time of induction of anesthesia. Okay, so please understand, it is not at the time of incision, it is at the time of induction of anesthesia. Please understand this. Okay, so what is the rationale? The concentration of the antibiotic should be maximum when you put an incision on the skin. Okay, so that is the rationale behind it. I hope you understand this. Okay, so let us move on and let us talk about the next particular question. Now these findings are characteristic of which disease? Now I'm very sure you must be well aware of this particular figure in dermatology, but it is also a disease of surgery. So I just thought of including this. So what is this characteristic facies which is being seen on this particular image? So can you tell me what is the characteristic facies? There is some characteristic facies which is associated with this. Can you tell me guys, anybody? So Nabrun is saying it is lepromatous leprosy. That's fine, but can you name the facies Like what is the characteristic facies in this particular patient? Very good, number one. It is a leonine facies. So what this image is showing you, it is showing you the leonine facies, and it is a characteristic feature of lepromatous leprosy. Please understand this. I'm very sure that you must be aware between the basic difference between lepromatous and tuberculous leprosy. So tuberculous leprosy more involves the nerves, and lepromatous leprosy more manifests as a skin disease. Okay. And the tuberculous leprosy also presents as a hypopigmentation. Okay, so I'm very sure you must have covered this in dermatology, but it is again a very important part of surgery also. Why? Because in leprosy what happens, there is a deformities of the limbs and everything, and plastic surgery used to play a very important role in rehabilitation of patients of leprosy. Okay, so yes, no doubt in this particular question the faces which have been shown is a leonine facies, and yes, it is characteristic feature of a lepromatous leprosy. Sure, good. Right, now this is something which you should know this. Okay, so can you tell me what is this? So a gangrene developed in a patient in a post-operative period involves the anterior abdomen. What is this type of gangrene? Okay, so in a post-operative period what happened, the patient had development of a gangrene, and gangrene developed in the patient and it involved the anterior abdomen. What is this type of gangrene? Can you tell me what is this type of gangrene, guys? Spot diagnosis. Okay, so it is an important image. You must have definitely heard about this, but you're not able to kind of recollect or talk about it. So can you tell me, guys, what is the thing over here? Anybody, guys? Gas gangrene. Okay, good attempt, Laya, but is it? It's not. Okay, so well, yeah. To be more specific, anybody? Clostridium perfringens, gas gangrene. Okay. No, guys, have you ever heard about Melanese gangrene? Okay, so have you heard about Melanese gangrene? Okay, I'm sure you must have heard about this. So this is something which is a post-operative gangrene. Okay, so this is a Melanese gangrene. Please understand this. This is a patient of a Melanese gangrene. What is a Melanese gangrene? It is a synergistic infection which occurs in a post-operative period. So what did I tell you? The patient is post-operative and it is involving the gangrene of the anterior abdominal wall. So well, yes, no doubt Clostridium perfringens may involve that. Okay, so what is the most common organism which leads to this Melanese gangrene? So please understand, it is a synergistic infection. So what happens here? There is a synergistic infection between the aerobes and the anaerobes, and no doubt Clostridium will definitely come in here. Clostridium will have a role to play in this. But if they ask you specifically what is this type of gangrene, so answer to this particular question is in fact Melanese gangrene. Okay, this is what I was expecting from you. Okay, so please understand, post-operative gangrene, anterior abdominal wall, Melanese gangrene. And yeah, another point is, what is the most common organism which is associated with this? So please understand, what is the most common organism which leads to this? I'm really sorry for my laptop. Okay, so what is the most common organism associated with this? Please understand, it is also referred to as a synergistic gangrene. Okay, it is called as a synergistic gangrene. Okay, so what do you understand by the synergistic gangrene? It is caused because of kind of a gram positive, like aerobes as well as anaerobes. Okay, so staphylococcus and everything will also be involved, but at the same time, yes, Clostridium will also be a very important part of it. Okay, so yes, this is Melanese gangrene, synergistic gangrene. Right, now let us move on to the next particular thing. Just a minute, guys. Okay, right. So in typhoid, we get what kind of ulcer? So what kind of ulcer do we get in typhoid? Do we get a vertical ulcer? Do you get a transverse ulcer? Do you get a flask-shaped ulcer? Or do you get a buttonhole ulcer? So can you give me the diagnosis over here? So what kind of ulcer do we get in patients with typhoid? But this is also very, very important. You must have definitely read it at least in your second year pathology vivas or something like that. So Kevin is saying A, okay, and Madhu is also saying A. Are they correct, guys? So other guys, please answer. Vertical, vertical. Very good, guys. So this is basically the difference between the typhoid ulcer and a tubercular ulcer. Okay, so in the typhoid, what do we get? We get a vertical ulcer. But this transverse ulcer, this is more commonly present in the tuberculosis. Okay, so please understand this. Tuberculosis. Now, what is happening over here? Because okay, and what is the most common site of typhoid ulcer or a tuberculosis ulcer? Both involve the ileum. Okay, so ileum portion is the most commonly involved or affected, and to be specific here, in the typhoid we get a longitudinal ulcer, and TB we get a transverse ulcer, and amoebic. Very good. So basically Kevin has summed it for us. So very good to Kevin. In the vertical ulcers we get it in the typhoid, in the transverse ulcers we get it in the tuberculosis, and this flask-shaped ulcers, this is seen in the kind of amoebiasis. Very good. And what about this buttonhole ulcers? So these are basically seen in the inflammatory bowel disease. Okay, so these can be seen in inflammatory bowel disease. Not very specific, but yes, they can be seen in inflammatory bowel diseases. Okay, right. Now, let us move on to the next particular question. Which of the following is not a component of SIRS? Okay, so what is SIRS? It is systemic inflammatory response syndrome. Okay, so can you tell me which of the following is not a component? Again, a very simple question, but something which you need to understand. Heart rate, respiratory rate, blood pressure, and the temperature. Which is not a component of SIRS? Can you tell me, guys? Anybody, guys? So Adi is saying it is C. Okay, Nabrun is also saying it's C. Well, guys, okay. Yash, why are you saying it's C? Sunita, why are you saying it's okay? Okay. See, such a simple question, but many of you are like telling me the wrong answer. So please understand, it is not A. Okay, it's not A. The answer is in fact C. Increased heart rate, it is a component of SIRS. Please understand this. Respiratory rate more than 20, it is a component of SIRS. Temperature, yes, definitely. Rise in temperature or a fall in temperature, definitely it is a component of SIRS. Ria, the answer is not A. Answer is C. Please understand this. The answer is C, that is blood pressure. Blood pressure is not a component of SIRS. Please understand, guys. See, the simpler the question is, the more people did it wrong. Are you understanding, guys? So please stay along. Okay, so please kind of revise the basic stuff. It is a very simple question. You must have heard about this at least 1,000 times. SIRS, and yes, blood pressure is not a component of SIRS, but heart rate, respiratory rate, temperature, and what is the fourth component? WBC count. Okay, so WBC count more than 12,000 or WBC count less than 4,000 with a band forms more than 10%. This is kind of a diagnostic of SIRS. Now, what is this SIRS? This is systemic inflammatory response syndrome. Now, if I ask you, is it specific for sepsis? The answer is no. SIRS is just a state of a body. It can occur due to any stressful condition, maybe after a severe trauma, maybe after a very extensive surgery, or any kind of a stressful condition for the body may land up into SIRS. In acute severe pancreatitis, yes, even in that patient land up into SIRS. And if at all 2 or more of the components are positive out of the 4 components, what are the 4 components? Heart rate more than 90, respiratory rate more than 20, temperature kind of more than 99 Fahrenheit, okay, and then WBC counts more than 12,000 or less than 4,000 with band forms of more than 10%. This is kind of a characteristic of SIRS. 2 or more than that, it is a characteristic of SIRS, systemic inflammatory response syndrome. Okay, right. Now, most common cause of infection associated with most common cause of organism associated with the infection involving the central liners. Okay, so this is basically the most common organism associated with the infection involving the central liners. Okay, so in the central line, if we talk about the catheter related complications, most common catheter related complication is infection or the sepsis. Okay, so the most common central line catheter related complication is infection or the sepsis. Now what I'm trying to ask you is, which is the most common organism responsible for this? Okay, so is it Staphylococcus epidermidis or it is a Staphylococcus aureus? Now all of you are going for a Staphylococcus epidermidis. Are you guys correct? Okay, no one for aureus? Okay, right. Well, forms biofilm. Okay, well, yes, definitely. The answer is in fact a Staphylococcus epidermidis. Why? Because see, understand, any kind of a catheter which you put in, for example, let's say an IV cannula or something like that, the most common organism associated with that particular infection is Staphylococcus epidermidis, or to be specific, coagulase negative Staphylococcus aureus. Okay, so even in the central line, the most common organism associated with this is Staphylococcus epidermidis. Please understand, Krish and Sindhuja, the answer is not B, the answer is A, Staphylococcus epidermidis. Okay, please understand this. Okay, but if they change the question to which is the most common fungal organism, okay, so if they ask you which is the most common fungal organism associated with this, then the answer will become Candida. Okay, so if they ask you most common, I'm really sorry guys, okay, so if they ask you which is the most common fungus associated with this, so please understand the most common fungus associated with this in fact is Candida. Okay, so you have to understand this. Okay, please understand this, right? Okay, good, right? Okay, so this is all about the basics of the infections which we covered for the general surgery. So I just covered the 10 important MCQs which I thought which might be helpful for you in the general surgery part. So this is basically the end of the session, right? If you want me to conduct any particular topic in the YouTube, please put up on the comments. I'll definitely try to cover it. So guys, I'll just wait for a couple of minutes for you. If you want any particular topic to be covered on the YouTube, just put it up. So I'll try to cover it before your NEET 2020. And today at 4 o'clock, I have another kind of a session, half an hour small session related to all the like the image quiz part 2. Okay, so you must have seen my image quiz part 1. So today I'll be coming up with the image quiz part 2 at 4 o'clock. If you guys want, you can come and attend it. Okay, so which topics to revise in the last 10 days? Okay, so well, which topics to revise in the last 10 days? Well, there's no kind of a particular list of the topics. What you need to revise is the 80% of the most commonly asked topics. Okay, if you want me to enumerate the topics, it will be a kind of a big list, and again it varies from person to person because of every subject. Even the person has some strong area or not a strong area, but I can definitely tell you about the sequence, how you should go about it. Okay, so the sequence can be like this. For example, you can start with the general surgery part, then you move on to the GIT and the GUT, and finally you can try to cover up a urology. But what I will suggest is, for example, whatever kind of a topic you start with, just try to have a look at the important topics of that. Okay, just try to have a look at the important topics of that and then move on to the next topic. So rather than revising one topic in totality, revise 70 to 80% of the most important topics of those and then move on to the next topic and then move on to the next topic. Okay, that's what I will suggest to you. Okay, so if you want a list, well, I really don't have a list kind of a thing. I mean, it's useless to give a list because I will be ending up giving you, let's say, 120 topics, 140 topics, which will basically cover the entire general surgery. And I mean, you already know those 100, 140 topics. Okay, and if you want me like, if you want just 10 to 20 topics, I'll be lying to you because I really don't know which questions will be coming from which topic. Okay, so if somebody says you that just revise these 30-40 topics and you'll be good to go, absolutely bullshit, not happening. Okay, so yeah, thank you Navrin so much. You liked my classes on Unacademy. So well, yes guys, I mean, yeah, thank you so much. And yeah, I know that you guys are very much lack of timing, but if you guys like our platform, we are trying our best to provide the value added content and we are trying to help you in your studies. So yeah, if at all you like our platform, just help us by spreading the word, help us by telling it to your juniors so that next year they might get benefited from you. But yeah, that's fine, that is the secondary. First, now concentrate on your exams and you will definitely do well. Okay, yeah, thank you so much guys. And yeah, all of like many of the suggestions were for the sutures. I'll definitely cover the session on the sutures, don't worry. So sutures, blades, knots, I'll definitely be doing it. Let's keep it tomorrow. Okay, so tomorrow Christmas, tomorrow half an hour session on the sutures and the blades and everything. I will be covering I'll be taking up a session tomorrow at let's say again 4 o'clock. Okay, so 4 to 4:30 in the evening. Are you guys okay with this? Right, so tomorrow knots and everything, knots types, definitely, no doubt. So sutures, knot types, blades, everything tomorrow 4 o'clock for sure. Okay guys, done? Okay, good to go. So thank you so much for joining with me today. It was indeed a pleasure interacting with you guys, and yeah, thank you so much. If you're not following me on Unacademy, please follow me on Unacademy. And I am a first year student, so hope this grows more. Yeah, definitely, it will definitely grow more. And if at all like you are in the first year and if at all you want to be a part of a foundation program, see, understand, if you take up a 1 year subscription of our coming kind of a month, coming year, you will have an unlimited access to all the videos there. So even if you are a first year student, we will be organizing small courses of all the subjects, and there will be not like you'll be able to have a look at only my videos or any other faculty's video. All the faculties which are available on the platform, you will have unlimited access to any number of videos. Okay, so if at all you are in the first year and if you like this platform, I will suggest you to go for a 1-year subscription. If you use my promo code dr.pawan, you will get around 10% off. So yes, you can definitely consider it. If you find that it will add some value to you, you can go for it. Okay, so yeah, and this will definitely grow. Don't worry, we are kind of determined to grow this to a really good place, and yeah, we are working very hard to bring out a value added content for you guys. Okay, so thank you so much for joining with me today, and it was indeed a pleasure interacting with you. All the best for your NEET PG, guys. Don't lose hope. Keep on reading, keep on revising the basic stuff. 70-80% of the topics, that is very, very important. Stay focused on the exam. If you have not watched, you can definitely go back and have a look at my like how to handle last 10-12 days video. I just did it yesterday on the YouTube. You can have a look at that. It will definitely help you. It will help you kind of stand up to your anxiety if at all you are having before the NEET PG. Okay, so thank you so much for joining with me today. Right, okay, that's good. So now we are also come up with the NEET PG, so yeah, I think you can make use of it. Okay, so good. I'm really hoping to see you, Parikshit, in the coming year. So I'm really waiting to see you in my classes next year. Okay, so thank you so much for joining with me today. Without wasting any more time, I'll just sign off. Today evening 4 o'clock I have a session on the image quiz, and tomorrow 4 o'clock I have scheduled the session for the sutures, notes and everything. Hope to see you there. Okay guys, have a great day. Happy studying. See ya. Bye.